So, Module 1, Overview of Medicare Program Basics, Choices, Eligibility, and Benefits. And this will help you to pass the mastery test at the end of the 5 modules, because each night as we go through the modules, at the end of the module, you'll be able to go to Ahip. Once you have registered and paid, you'll go to Ahip and you can actually take the practice tests as many times as you need to until you have all of the practice test questions correct. And if you do not have a question correct when you're completing the practice tests on your own, after the module review, the answer is there. The practice test will tell you it was incorrect and tell you why it was incorrect and explain the correct answer. This way, after you've gone through all 5 modules, when you get to the mastery test is made up of the questions from those practice tests. So that's how you are assured to pass your mastery test the first time. So you cannot move from module 1 to module 2. You can't start with module 2 until you've completed module 1. Unless, of course, you are someone who has done these tests for several years, you can bypass module 1 and module 2 and go right to module 3. I would suggest that you go through all 5 of them, because you never know when there is one little thing that is changed in any of the modules. So go through all 5 of them, and because we're doing them one each day, it should make it easier for you. So after completing module 1, you're going to be able to explain that Medicare is a federal health insurance program for individuals who are aged or disabled. You all know that to get Medicare, you have to be age 65, or if you're under 65, you have to be disabled and collect Social Security disability for 2 months, or you must have end-stage renal disease or Lou Gehrig's disease. Everybody knows that. And if you don't, that's one thing you're going to learn. Those are the only ways that people are eligible to receive Medicare. You will be able to gain an understanding of the different ways that beneficiaries can choose to receive Medicare coverage, including how to use original Medicare or a Medicare Advantage program. In Module 1, we will list the various parts of Medicare, A, B, C, D. And yes, there is an E, which we'll learn about later on, but all of the parts you will learn about in Module 1. You'll be able to understand who's eligible for original Medicare. You'll be able to know what Part B premium means and Part A premium means. You'll also be able to explain who qualifies for coverage and have to pay a premium or will not pay a premium. You'll also understand those who have the higher incomes and how IRMA plays into the role for those to pay additional premiums. In Module 1, you will get original Medicare and the benefits provided under Medicare Part A, which is known as hospital insurance, and Part B, which is known as outpatient services. You'll gain the knowledge about Medicare Parts A and B benefits and the cost sharing. You'll have a basic understanding of Medicare Part D, D for David, for prescription drug coverage, and how it is coupled with original Medicare. You'll also review original Medicare beneficiary protections, learn about help for individuals with limited income, gain an understanding of what a Medicare supplement, or sometimes known as Medigap plan, is and the role that it plays with original Medicare. In Module 1, you'll be able to explain the Medigap plans that are available to original Medicare beneficiaries and learn about changes in Medigap for those who became eligible after December 31, 2019. So the overview for Module 1, we will start. And as I said, you'll see these two buttons. One says training and one says review. When you come back to Module 1, you can take the Module 1 review, and that's where your practice test is. So rather than go back through all of the training slides that we're going to go through tonight, you're going to go to take the Module 1 review and then take the practice test for as many times as it is necessary for you to have all the questions correct. There's no limit to the number of times you take the practice test. The mastery test does have a limit, but the practice test does not. Okay, Medicare Module 1. As you can hear, she is speaking and I'm going to mute her. So these instructions will be at the beginning of every module. So you'll know to use the previous button if you want to go back, use the next button if you want to go forward. You're required to look at each slide. So going through it this way with me, you'll go through these slides faster than if you were doing them individually for most of you. Some of you can glance and read probably faster than I can, so that may not be true for everybody, but trust me, you will go through these slides pretty quickly because we'll cover just what's important for you to know. If you want to click on the menu icon, you'll see it looks like this little symbol, and it'll be up in the upper left-hand corner. You can start and stop audio by clicking on the play or pause button. I just stopped the audio. And you can download the content for the slides in the left-hand corner under download content. So if you want to download the content so that you have that as a reference, when you get ready to take your test, you can do that as well. See over here on the left, download slides. So when you go into your Module 1, you can download those slides, save them in a file, in a PDF file, label it 2026 Ahip Module 1. And then every time you do a module, you can download the slides if you feel you need to. These instructions, as I said, will be at the beginning of every slide. Every module, I'm sorry. Terms and conditions, this is going to be standard through every module. The training program, of course, is protected by the United States copyright laws. We cannot take any of the information, alter it, distribute it as our own, or anything to the like that nature. I'm just going to ask that everyone, if you will, mute your microphones, please. Make sure that all your microphones are muted. If you have a question, you can raise your hand and I'll stop and answer the question, or you can put it in chat. This training program is, of course, designed and intended to be a guide only in identifying factors for consideration in the basic rules and regulations governing coverage eligibility, marketing, enrollment for Medicare, Medicare supplements, Medicare health plans, and the Part D prescription drug plans. It is not intended to be legal advice. So these are the learning objectives for Module 1. The different ways that you can get Medicare benefits, eligibility and coverage under Part A and Part B, original Medicare premiums, help for beneficiaries with limited income, and combining original Medicare with Part D. The basics in Module 1, this is your roadmap. Each of these things will be covered. Medicare program basics, Medicare eligibility, enrollment, entitlement, and premiums, help for individuals with limited income, original Medicare cost sharing, original Medicare beneficiary protections, Medigap coverage, Medicare coordination with employer group plans. Okay, the first one, Medicare program basics. Medicare is a federal health insurance program. Everybody knows Medicare is a federal program. Medicaid is a state program. Medicare is for individuals who are age 65 and older, and younger individuals who have serious health conditions, are disabled, and have collected Social Security disability for 24 months. Medicare eligibility does not take into consideration income. Individuals may pay higher premiums, however, based on their income, and low-income individuals may receive assistance, so they don't pay certain premiums or certain copays or certain coinsurances. So lower income gets assistance, higher income may have more money to pay. Individuals can receive their Medicare medical coverage directly from the federal government, which pays for services on a fee-for-service basis, and that's known as original Medicare. Fee-for-service simply means that when a service is provided by a Medicare-approved provider, that provider bills Medicare, and Medicare pays that provider a fee. The fees vary geographically. The fees vary definitely by whatever service is provided. And Medicare sets those fees. So the same doctors in the same area that are performing the same services, if they're accepting original Medicare, they're getting paid the same fee. And that's why Medicare is called fee for service. Original Medicare is fee for service. Individuals who receive their Medicare Part D prescription drug plans must get them through a private health plan. Medicare does not offer a plan that has prescription drugs any longer. That was years ago. No longer. So even though the medical coverage is through original Medicare, the prescription drug piece has to be through a private insurer who has a prescription drug plan that has been approved by Medicare for the area. Medicare began as a fee-for-service program under which beneficiaries would receive their health care benefits from any Medicare provider and have the provider paid directly by the federal government. Medicare evolved to give beneficiaries an option of receiving their benefit that way through the fee-for-service, or they could receive it through managed care plans that maintain contracts with networks of providers. Those are the plans that you know as Medicare Advantage plans. Beginning in 2006, Medicare began providing coverage for outpatient prescription drug through private health plans. Medicare coverage is often known as the part of Medicare law under which it's authorized or regulated. Parts A and B are the basic Medicare benefits. These benefits are covered regardless of how an individual chooses to receive their Medicare benefits. So what does that mean for you? It means that if an individual is choosing to get their benefits through original Medicare, the fee for service, or through a managed care program, a Medicare Advantage plan, the same benefits for Part A and Part B are going to be covered under either of those options. Now, they will be covered different, so the benefits will be delivered differently. But if it's covered by original Medicare, it's also covered by the Medicare Advantage plan. Inpatient hospital care, including care provided by acute hospitals, critical access, inpatient rehab services, and long-term care hospitals, is included under Part A. Part A also includes blood. It includes up to 100 days of home health care after an individual is in a hospital or skilled nursing. Part B covers home health care without the prior hospital or SNF stay, but Part A picks up if they have been confined. Skilled nursing and rehab care up to 100 days, but only after a 3-day hospital stay. Now that applies to original Medicare. Medicare Advantage plans may waive the 3-day hospital stay requirement. Hospice care is also a Part A benefit, and inpatient psychiatric care is also covered under Part A because it's inpatient, but unlike inpatient medical care, inpatient psychiatric care has a lifetime limit of 190 days. Part B is referred to as supplementary medical insurance benefit. It covers a broad range of outpatient services, and generally those are your doctor's office visits and other healthcare professional services, outpatient hospital services, clinical labs, diagnostic tests, x-rays, MRIs, CAT scans, durable medical equipment, home health care that is not covered under Part A because the individual was not in a hospital or has exceeded 100 days, physical and occupational therapy, ambulatory surgical centers, and chemotherapy are all Part B expenses. There are some other Part B expenses that include ambulance services, chiropractic services, but chiropractic care for Medicare is limited to only those Medicare covered procedures for chiropractors. Only Medicare covered procedures. And generally that is manipulation for subluxation of the spine or other areas. It's very, very specific. Chiropractors know what is covered by Medicare and what is not covered by Medicare. Usually those maintenance visits for chiropractic care generally are not covered by either original Medicare or Medicare Advantage plan. Opioid use disorder treatments are covered under Part B. Preventive services, all of the preventive services that are approved to be covered by Medicare are covered under Part B of the plan, and there's no cost sharing for any of those covered preventive health services. Those may include vaccines, mammograms, smoking cessation, and the vaccines have recently expanded to flu, COVID, pneumonia, and shingles. Diabetic supplies are also Part B expenses. Kidney dialysis is a Part B expense. Outpatient mental health has a Part B coverage, but there may be limits to outpatient mental care. Virtual checkups using video and audio technology would be a Part B expense. Continuous positive airway pressure, CPAP devices, those are Part B expenses. Before I go into Part C and the overview of Medicare benefits with Part C, which is going to be your Medicare Advantage plans, are there any questions about who's eligible for Medicare or Part A of Medicare, Part B of Medicare? Any questions? Okay, we're going to move right on. Overview of Medicare benefits, and now we're at Part C. C for Charles. Part C regulates and authorizes Medicare Advantage plans. Those are your private health plans that contract with the government to provide and administer Medicare benefits. Medicare Advantage plans must cover Part A, except for hospice, and Part B benefits. So it's covered by Original Medicare, Part A and Part B. It is also covered by your Medicare Advantage plan. Just remember that the service may not be delivered in the same manner that it would be under using Original Medicare. Medicare Advantage plans may also cover items that are not covered by Original Medicare. Individuals enrolled in a Part C Medicare Advantage plan still have hospice benefits, but if they are diagnosed as being a hospice patient, Original Medicare pays all of the hospice expenses. Part D. Overview of Medicare benefits and coverage for Part D. Part D for David. D for dog. D for drugs. D, prescription drug benefits. This is the portion of the plan or part of the plan that covers prescription drugs for self-administered drugs, such as those that are picked up at the pharmacy or delivered by mail order. It is not for those injectables that are given in the doctor's office or as an outpatient at the hospital or as an inpatient at the hospital. That is not Part D. If it's inpatient at the hospital, it comes under Part A, hospital. If it's given as an injection in the doctor's office, it is possibly a Part B. It is not a Part D. Part D are the ones you pick up at the pharmacy or have delivered. Part D benefits are only offered through private health insurers whose plans are approved by Medicare. There will be some plans coming up that will be offered for prescription drugs, but may not be commissionable. Do what's best for your customer, guide them to where they need to go, and do what's best for your business. Part D benefits are only offered through the private health insurance and some Medicare cost plans, PACE plans, and those standalone Medicare prescription drug plans. So remember this, the ways that you can have a prescription drug plan through a Medicare Advantage plan, so it's an MAPD plan, a Medicare cost plan, which very few of us see because they're not all over the country, a PACE plan, and I'm not sure what PACE stands for. I could look it up, but you could look it up too. And a standalone prescription drug plan. So the standalone prescription drug plan would apply if someone is using original Medicare. But it's important because this question will be on your test. So remember I said there was Part A, Part B, Part C, Part D, and Part E, which to my surprise last year, I learned that there was such a thing as a Part E. So Part E is a lesser known Medicare law that regulates other miscellaneous programs. Programs like Medicare cost plans, which also cover Medicare Part A and B benefits. Medicare cost plans are only offered in a limited number of states and are most frequently found in rural areas. And this is why most of us are not familiar with Medicare cost plans, but it's a question. There'll be something on your mastery test about cost plans. So if you need to take a picture of the slide, or as you're going through it yourself and you go back through the slides and you click next, 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 next to get here so that you can write it down. Just remember, there is a Part E so that it doesn't seem foreign for you. The Part E is also that law that regulates the Medigap plans and the PACE programs. So PACE stands for Program for All-Inclusive Care for the Elderly. I knew it was going to come up soon, so I didn't have to remember it. PACE stands for Program for All-Inclusive Care for the Elderly. What are the different ways to get Medicare? There are different ways that beneficiaries can choose their Medicare coverage. They can choose original Medicare, which covers them for Part A and Part B benefits. Under original Medicare, they can receive covered services from any physician or facility that accepts Medicare anywhere in the United States. So it's not a network. It's who accepts Medicare. And you would think that all doctors accept Medicare, but all doctors do not. Some practices are built so that they do not accept original Medicare. Just understand that happens. And there are some practices that are not connected to Medicare because of Medicare's choice. So Medicare has decided they don't want to contract with those providers. So not 100% of every doctor that has an MD or a DO behind their name, they've done the studies, they got the license in their state. It doesn't mean that they accept original Medicare. No referrals are required if you're using original Medicare. Original Medicare has substantial deductibles and other cost sharing, which in the information that you're going to be going through for 2026 certifications will still have the 2025 information. In fact, when the 2026 Medicare and You Handbook is printed, it will have the 2025 deductibles and coinsurance. Those things come out after we're already into AEP, but those numbers will change. They're going up. We already know that they're going up, but they may not be in print material at the moment. So original Medicare can be optionally combined, and it's optional because the individual can choose not to have a Medicare supplement or a Medigap plan. If they do not choose a Medicare supplement or a Medigap plan, then those deductibles, those substantial deductibles, and those substantial cost sharing of coinsurance that Medicare, original Medicare has, will come out of their pocket. And there is no maximum out of pocket. There's no annual limit. There's no lifetime limit for those medical out of pockets. So it behooves them to, if they're going to choose original Medicare, to purchase a Medicare supplement or Medigap plan from a private insurer. And it's your job to find that plan that best offers them the most coverage for the less cost. All of the Medigap plans are going to be uniform. So it's not about this company is offering plan G and this company is offering plan N. They both may offer G and N, but which one has the lower cost for your customer? Or which one may have some perks that they add to their supplement that the other one doesn't, just to set themselves apart. Those are things you would know and find out about the particular supplement if that's what your customer wants or needs. Now, along with having original Medicare, a supplement that they're going to pay a monthly premium for, they also have to have a prescription drug plan, because if they have Medicare Part A and or B, either one, when they first become eligible and they do not have credible prescription drug coverage in place, later when they apply for drug coverage, they will have a late enrollment penalty. So they can have plan Part A that becomes effective on the first day of their birth month, but they're not working anywhere, or they're working someplace where they don't have insurance coverage, and they say, but I'm still working, so I'm not going to do anything. If they don't take a credible prescription drug plan at that time, then later they will have a late enrollment penalty. Medicare Advantage plans can be an MAPD or an MA. MAPD would be Medicare Advantage with prescription drugs. MA would be just Medicare Advantage without prescription drugs. So that's a choice that they can choose, but you would not suggest to someone to take an MA only plan without having credible prescription drug coverage someplace else. Medicare prescription drug plans, standalone plans, of course, added to, that's the plan that's added to the three parts, the original Medicare, the supplement, and the standalone prescription drug plan. Medicare cost plans can be combined with a Medicare prescription drug plan. And PACE plans is another way that they can get coverage. So looking at the chart, different ways to get Medicare, just as a brief overview, Part A and B benefits is in the first column. Some of the cost sharing for Part A and Part B is in the second column. Part D benefits are in the third column, and other benefits are in the fourth column. So if someone's using original Medicare, their options are still to use original Medicare with a supplement, or original Medicare with a supplement and a prescription drug plan. An individual can have both. They can, if nobody ever follows up and helps them, but you could lose your eligibility to sell plans if you offer someone who has a Medicare Advantage plan a Medicare supplement plan. And that is simply because they can never use it because they're using Part C, not Part A and Part B. And you can only use the supplement with original Medicare, Part A and Part B. Any questions on that? Okay, so now at the end, if anybody has questions, we'll still have questions and answers in case something comes up, but don't be afraid to ask your questions. And then if you don't get your questions in, you can always reach out and send me a text or an email. Medicare eligibility, enrollment, entitlement, and premiums. We're going to the next section. I think we beat that section down. So to be eligible, and this is kind of repetitive, it's something that everybody on here knows already. To be eligible for Medicare Part A and Part B, an individual must be 65 or older, under 65 with certain disabilities or health conditions, collected Social Security disability for 24 months, have Lou Gehrig's disease or end-stage renal disease. They also must be a United States resident and be either a United States citizen or an alien who's been lawfully admitted for permanent residence and been residing in the United States for 5 continuous years before the month of applying for Medicare. So they can meet the age requirement, but because they're not a United States citizen, they live here as an alien and they have permanent residence in the United States, they must live here 5 continuous years before they can apply for Medicare. So that means they could be more than 65. Individuals with end-stage renal disease are eligible for Medicare. However, they will lose their eligibility for Medicare 36 months after the month in which they receive a kidney transplant, unless the individual is eligible for Medicare on another basis. So this is an example of someone who might be under 65, but because they have end-stage renal disease, they have Medicare, and then they're on a transplant list and they get a transplant, and 3 years after the transplant, then they are no longer eligible for Medicare if they are not meeting any of the other requirements. So let's say they were age 55, they got the transplant, 3 years later would be 58, so they're still not 65 yet. So they're not eligible. They would lose their eligibility. Remember that question. Remember that when the person loses their eligibility. Now, if the person it's necessary for them to have certain immunosuppressive drugs and they have no other coverage, they may be able to continue to be a part of Medicare Part B. So that's the kind of caveat Remember that. Some people are automatically enrolled in parts A and B, subject to the Part B exception below for Puerto Rico. Individuals who are already receiving benefits from Social Security, you can collect Social Security at 62. So let's say someone starts to collect Social Security at 62. So Social Security already knows when that person's going to be 65. They may also be collecting railroad retirement. They will be automatically enrolled in Medicare Parts A and Part B starting on the first day of the month that they turn 65. If someone's birthday is the first of the month, on the first, then their Medicare eligibility date is the first of the previous month. Does that make sense to everybody? Individuals with disability who are under 65 are automatically enrolled in Part A and Part B once they have received 24 months of disability. However, they have an opportunity to refuse Part B coverage because Part B does have a premium. So they could refuse the Part B at that time. Individuals with ALS, also known as Lou Gehrig's disease, get Part A and Part B automatically the month their Social Security disability begins. And individuals living in Puerto Rico are not automatically enrolled in Part B, are not automatically enrolled in Part B. They must sign up for Part B. Other individuals will have to sign up. Anyone who I did not mention just in that segment will have to sign up if they want to be enrolled in Parts A and Part B. So as people are getting close to 65, but are not getting benefits from Social Security or railroad retirement, they should sign up for Part A and B during their A and B initial period, which is 3 months before their 65th birthday, including the month they turn 65, and ends 3 months after. Individuals with end-stage renal disease can sign up at any time. However, the date on which their coverage begins is usually the 4th month after dialysis starts, but it can be earlier depending on certain conditions. Individuals eligible for premium-free Part A can also sign up for Part A at any time after they turn 65. Their Part A coverage starts 6 months prior to when they signed up, but cannot start earlier than the month they turn 65. If they have not signed up by the time they apply for Social Security, they will automatically be signed up and the coverage will be retroactive for 6 months. Eligibility for Parts A and B in the Part A-B initial enrollment period. Initial enrollment period for individuals who do not enroll in Part B or Part A, if they have to buy it when they are first eligible, they can enroll during what's called the general enrollment period, which each year is from January 1 to March 31st. and coverage begins the first day of the month following the month in which they enroll. Individuals who have group health coverage based on their current employment or their spouse's employment may enroll in Part A and or Part B anytime while covered under the group plan or during a Part A, Part B special enrollment period that occurs during the 8th month period following the last month that their group coverage ended. Now, just remember that if someone is still working and they have credible coverage, do not encourage them to take Part B because they lose guarantee issue eligibility in most states. Individuals eligible for premium free Part A may sign up at any time. There are also Part A, Part B special enrollment periods that allow individuals to enroll after Part A, Part B initial enrollment due to issues such as emergency or federally declared disasters in their area, release from incarceration, loss of Medicaid, health plan, or employer error that caused them to miss their initial enrollment period. An individual is entitled to Part A if they're eligible for premium-free Part A, or if the individual has enrolled in Part A and continues to pay the premium or have the premium paid on their behalf. For individuals to enroll and remain enrolled in Part B, the individual must pay the Part B premium or have the Part B premium paid on their behalf. If you want to take a copy of this screen, you can, but you know where it is. If you need to come to it and take a picture or download it so that you have it when you get ready for your mastery test, it's a chart that tells you when people should enroll. And it's pretty clear. Medicare premiums, Part A. Most individuals are entitled to Part A without paying a premium, and that's because they have worked or their spouses worked and paid into Medicare taxes for at least 10 years or 40 quarters. The 40 quarters don't have to be consecutive. They could be any time throughout the lifetime of the individual or the spouse. Just 10 years that they paid into, and it doesn't matter how much they paid. Some people will have paid thousands. Some people will have paid less than that. It doesn't matter. It's not how much is paid in. It's that they did pay in during those 40 quarters or 10 years. Then they receive Medicare Part A without a premium. All individuals who are eligible due to disability, end-stage renal disease, or Lou Gehrig's disease are also eligible for premium-free Part A. For those individuals who do not automatically qualify for Part A, the monthly premium for 2025 is $518 if they worked and paid for less than 30 quarters, or $285 if they paid in for 30 to 39 quarters. So there is a difference, and those numbers will change because those are the numbers for 2025, but those might be the numbers that you'll see on the test because the 2026 numbers, although they may be published, have not been actually put out yet. Individuals who are not eligible for premium Part A and those who do not buy Part A when they're first eligible may pay a late penalty of up to 10% unless they enroll during a special enrollment period. they will have to pay the higher premium for twice the number of years they could have had Part A but did not sign up. Medicare Part B premium for 2025, it's $185 a month is the standard. However, for some people who have income that's greater than the standard amount, they will pay a greater amount for Part B, and they will pay a premium for Part D as well. However, some people will not pay at all based on their income because their Part B premium will be subsidized. So this is the chart that tells you who pays at the standard and who doesn't. So any individual whose income is less than 106,000 for 2025, or if it's a joint tax return and it's less than 212,000 for 2025, the Part B premium is 185. For each of the next 1, 2, 3, 4, 5 stages, as income increases, the amount of Part B premium increases. So someone whose taxable income for last year was $215,000 will actually pay, and they're single, will pay $591.90 as their Part B premium. Is that clear? Part B payment mechanisms and penalty. Part B premiums may be deducted from Social Security checks, railroad retirement checks, Office of Personnel Management, or if the individual is not collecting Social Security or railroad retirement, the individual will have to pay, and it's billed to them in 3-month increments. Employers may also help their employees or retirees who leave by paying their Part B premium. Individuals who do not enroll in Part B when they're first eligible will pay an increase of 10% for each 12-month, full 12-month period that they could have had Part B but did not enroll. And that's known as the late enrollment penalty. Individuals who have group health coverage, that is credible group health coverage, when they change to an individual plan, they do not have the penalty because they were covered by a plan that was credible. Example 1, Miss Wex just retired at the age of 72. She didn't enroll in Part B when she was first eligible because she maintained her group coverage while working. She can avoid the Part B penalty by enrolling within 8 months of the time that her employer plan ends. Example 2, Mr. Rollins retired when he was 68. Before retirement, he was working part-time and was not eligible for the employer plan. Instead, he maintained a disease-specific plan because cancer runs in his family. Mr. Rollins did not enroll in the Medicare Part B when he was first eligible because he thought his Part A and his disease-specific policy would be enough coverage. However, he was recently diagnosed with diabetes and needs coverage for all his doctors and lab bills. Mr. Rollins can enroll in Part B during the general election, January 1 to March 31, whatever month he applies, it's effective the first of the next month. And he's going to have an additional 10% for each 12-month period since his initial enrollment. So it looks like that might be about 30% because he's 68 now. Help for individuals with limited income. Certain individuals with lower income may qualify for help to pay Medicare Part A or Medicare Part B premiums, Medicare Part A and Part B deductibles, and cost sharing, and some Part D prescription drug costs. These are some of the programs. Medicare Savings Program. The Medicare Savings Program helps pay the Medicare Part A and Medicare Part B, and some cases, deductibles and cost sharing. The Qualified Medicare Beneficiary, the QMB, is one type of Medicare savings that once the person is enrolled into a Medicare Advantage plan, it helps them with all of their Medicare Advantage cost sharing amounts. The Part D low income subsidy is also known as extra help, and that's help with specifically prescription drug coverage. So persons interested in Part D only, or Part D help only, can get the low income subsidy through Social Security Administration. Medicaid can help with healthcare costs not covered by Medicare, such as custodial and long-term care. Medicaid is governed by the states, and each state is different, has different rules. Some of them work on the federal poverty level, others work on different levels for the state. Persons who do not qualify for Part D low-income subsidy, but are of limited means for help in paying for Part D drugs can also look for a state pharmaceutical assistance program. Some states have that program in place. You should encourage your beneficiaries with limited income to visit their Medicaid office and ask for information on Medicare savings programs. Original Medicare cost sharing. Original Medicare cost sharing for hospital Part A, the deductible for 2025 is $1,676. So when someone is admitted to the hospital and they're using original Medicare Part A, their deductible is $1,676. Now, the deductible applies for each benefit period, and a benefit period begins the day an individual is admitted to the hospital and ends when they have not received hospitalization for 60 days consecutively. So if someone has to go in the hospital in January and then they don't go back in the hospital again until April, and then they go back in the hospital again in July or August, each of those times there's a separate 1676 hospital deductible. And the deductible covers the period for the first 60 days that they're in the hospital. So if they're in the hospital longer than 60 days, then days 61 through 90, they have a copay of $419 for 2025, and days 91 to 150, it's $838 per day. Those are the out-of-pocket costs where you would strongly urge them, if they want to use original Medicare, to have a Medicare supplement to pick up those costs. Lifetime reserve days are days when a beneficiary may use after they've been an inpatient for 90 days. So there are some lifetime reserve days, but the best scenario for someone who wants to use original Medicare as their option to purchase a Medicare supplement. Original cost for skilled nursing. Under original Medicare, skilled nursing is covered under Part A. The first 20 days, there's no copay. After those 20 days and up to the 100-day maximum, it's $209.50 per day. And beyond day 100, all of the costs belongs to the individual. So they're going to pay 80 days at $200. That's like $16,000. Is that correct? So that could be expensive unless they have a Medicare supplement that's going to pick up that for them. Original Medicare Part B cost sharing, there's an annual deductible of $257 for 2025. That will change for 2026. And then after the deductible, Medicare pays 80% of approved Medicare services, and the individual would be responsible for 20%. And again, the 20% has no cap. So whatever services they have throughout the year, the 20% is applicable. Protections for Medicare beneficiaries. We're getting near the close. Everybody about this time tends to start to nod off. So we're getting near the close. Beneficiary receiving their Part A and Part B benefits through Original Medicare have a right to appeal payment decisions. So they always have a right to disagree with what Medicare says. It doesn't mean that it's going to be approved, but they have the right to appeal. And the appeal must be filed within 120 days of the date that the Medicare summary notice detailing the financial responsibility for the individual is sent to them. Beneficiaries who believe their hospital, skilled nursing, home health care agency, comprehensive outpatient rehab facility, or hospice services are ending too soon have a right to a fast appeal. The provider will give them written notice before the end of their services, and the notice tells them how to ask for a fast appeal if they disagree. Beneficiaries must generally ask for a fast appeal no later than noon of the calendar day following receipt of the notice that their services are going to end. If a beneficiary disagrees with the appeal decision, they have 180 days after getting the decision to request a reconsideration by a qualified independent contractor. Additional levels of appeal may also be available. There are grievances and complaints that can be filed, and some of the complaints might include unprofessional conduct by a provider, improper care, unsafe conditions, abuse by a provider, or long wait times or unclean conditions. So the method of filing a grievance is different from filing an appeal. Those are two different things, but the Medicare beneficiary has the option for both. Additional beneficiary protections. Medicare operates a 24-hour helpline, and it's 1-800-Medicare. Beneficiaries can use this number to find out about their claim status, their coverage and benefits, premium payments, or ask a question about Medicare 24/7. Beneficiaries can also get assistance with Medicare, including help to file an appeal or a grievance. This says that there's information and help through the SHIPS program. That may not be as readily available in the coming year. A beneficiary in Original Medicare may receive Part D prescription drug coverage through a standalone prescription drug plan. Generally, except for those who are dually eligible, that would be those people who have Medicare and Medicaid, Medicare beneficiaries must select a Part D plan or a plan with Part D when they first become eligible. Beneficiaries who enroll in Part D typically will pay, if it's a standalone prescription drug plan, they're going to pay the monthly premium, they'll pay the annual deductible in the plan, and they'll also pay the prescription costs. So in selecting the Part D plan, you have to consider the overall total cost for the year based on the prescriptions that they're taking at the moment. So, and that also would include which plan covers the prescriptions that they have. In other words, those prescriptions are on the plan's formulary, and that they're also able to access network pharmacies. These are the places where you can get more information: www.cms.gov, www.medicare.gov, the Medicare and You Handbook, Medigap coverage. The Medigap, as we've said, works with original Medicare only. It does not work with Medicare Advantage. It's sold by private insurers, and it's used to fill the gaps, those deductibles that we just went over, and the coinsurance that Part A and Part B have, those out-of-pocket costs. That's what the supplement does. So think of the supplement like the truck pulling the trailer. The truck is Medicare. The trailer is the supplement. The supplement will only go where the truck takes it. So if it's not approved by Medicare, it's not going to be paid under the supplement. Medigap policies are available in standardized benefits, and the plans for supplements range from A to N. There are different plans that are available in different states. Turning 65 and signing up for Part B triggers a 6-month Medigap, what we call guaranteed issue program. That's where they can get Medicare supplement plans or Medigap plans without any health questions asked. Doesn't matter what their health conditions are. Once they are beyond that guaranteed issue period, then the insurance company can ask those health questions and can choose to accept or deny coverage. Now, some states are guaranteed issue states, so people can have Medicare supplements at any time. That's a caveat that's different. So the Medicare supplement plans, most of them, all of them, will pay some or these costs when they are approved services by Medicare. They'll pay the Part A coinsurance. They'll pay coverage for 365 additional days if you're in inpatient hospital. Remember, you have a lifetime maximum under original Medicare. Once you expire that or use that, exhaust that, then the supplement has an additional 365 days. The Part B coinsurance, it covers the first 3 pints of blood, and hospice care coinsurance or copayment if there is any. Beneficiaries with Medigap plans with or without drug coverage. Now, there are Medigap plans H, I, and J that are no longer available since 2006. However, some people have decided to keep them because they do have some prescription drug coverage, and they would have received letters if their plan that they have is not credible drug coverage. And if it's not, they need a standalone prescription drug plan. But individuals who enrolled in those plans need to really check to see if they should have a standalone plan to make sure that it's credible. To enroll in Part D, individuals who have those plan H, I, or J can keep their Medigap coverage with the drug portion and enrolled in a Part D standalone prescription drug plan, or drop their Medigap coverage, enroll in an MAPD plan that includes prescription drugs. If their Medigap policy lacks credible prescription drug coverage, the person may have to pay a late enrollment penalty. Individuals who attained age 65 on or after January 1, 2020 are no longer eligible if you become 65 after January 1, 2020, you're no longer eligible to enroll in a Plan C or Plan F. Only people who became 65 before January 1, 2020. Remember January 1, 2020. These are Medigap plans, and it shows what each of those plans will pay and the percentage. So if we're looking at a Plan G, which is the most popular one right now, it pays 100% for Part A expenses, 100% for Part B expenses, 100% of the first pint of blood, 100% of hospice care, and 100% of skilled nursing that's not covered by Medicare. And then Plan G also covers the Part A deductible. It covers the Part B excess. This is where doctors are allowed to bill 15% above the Medicare allowable amount. Most doctors don't, but some doctors do. And if they do, that 15%, if you don't have a plan that pays the excess, then that 15% above what Medicare approves is what you're going to pay, or the beneficiary is going to pay. For more information on the Medigap, go to cms.gov/Medigap or look in your Medicare and You handbook. Medicare coordination with employer group plans. The rules for what types plans employers can offer and whether Medigap pays primarily depends on whether the coverage is offered by a large group health plan, which would be a plan with 20 or more employees, or it has fewer than 20 employees. Whether the individual has coverage under the individual or the individual's spouse current employment. Medicare is primary for retirees covered under large group health plans. Medicare for individuals who are still working, large group health plans, 20 employees or more. Medicare prohibits large group health plans from considering that an individual or the individual's spouse covered under the plan based on current employment status is entitled to Medicare benefits. It also requires the large group health plans to provide any individual age 65 or older and the spouse who has current employment status the same benefits under the same conditions as they would anyone under 65. It is illegal for a large group health plan to encourage a Medicare eligible employee to decline the employer's group plan and obtain Medicare instead, or to offer them a different coverage than offered to individuals who are not Medicare eligible. This would include offering its employees and their spouses a Medicare Advantage plan, or offering to pay even a Medicare supplement plan for those individuals. Individuals with large group health coverage as a result of their coverage or their current spouse employment may choose not to enroll in Part B when they first become eligible if their plan, their group health plan, has credible coverage and they will not have a late enrollment penalty later. Medicare individuals who are still working and they're working for employers who are fewer than 20 employees. Medicare is the primary payer for individuals who have group health coverage as a result of their or their spouse's employment that is not a large group. So for those plans where it's fewer than 20 employees, Medicare is primary. And then if the employee chooses to be in the health insurance at work, that's secondary. So to be clear, if it's 20 or more employees, the group health plan is primary, Medicare is secondary. If it's less than 20 employees, the Medicare is primary and the group plan is secondary. For more information about Medicare secondary, you can take a screenshot if you want and click on those links. Or when you get to this slide, just click on the link and you'll get more coordination of benefits. Okay. So now this is where you would be, and you would start your review for Module 1. Are there any questions? Who's still awake with me?
We're here, Faye.
You are?
Yeah,
Thank you
we're
so
here.
much.
Yeah.
We're here wide awake.
Okay, good. Great.
And
Thank you.
thank you so much, Faye, for everything.
Yeah.
Thank you.
Oh, you're welcome. Listen, it's just I don't know. I hope that it helps everybody because it made such a difference for me rather than trying to go through each slide and read everything. And you'll see that there are certain areas that I already know what you need to know from that section. So thank you for being here. And just remember, if you ask for the passcode, it's more than likely, try this if all else, it's my cell phone number.
Miss
When
Faye,
I do a Zoom, I set it up so that it's my cell phone number. That way I don't have to go look for it. I know what it is. I could tell you right away. And thank you. I'm so sorry for those of you who had time getting in. Judy wanted to know when is the earliest we can enroll in devoted. Ahip is already open. You got to finish Ahip before you can start any of the certifications. But devoted is open tomorrow.
for the AHIP. Correct?
Devoted is open for certification tomorrow. And when you go into devoted, the first thing that you're going to have to do is pay for Ahip, go through the Ahip, finish Ahip, and then you can do devoted certification.
Okay.
Everybody got that? Is that confusing? Last year, it kind of worked out that we went through all 5 of the modules, and then everybody took their AHIP, and then they started to do their certs. So for those of you who are on fast track with United, you probably have already knocked that out. That's already done. Aetna, you don't have to do AHIP. You could go into Aetna, but Aetna's not available yet. And I don't suggest doing that. The one that is non-AHIP takes longer. It's up to you. Your choice. Okay. Any other questions?
Miss Faye, is devoted the only one that give you the $50 discount?
No, they all do. So it doesn't matter which one you go through first, you'll get the $50 off to get to AHIP. You could do Humana first, whichever is available. It's just devoted as the first one, the first date that's been announced as being available.
Okay, so United Healthcare is included in that one or not?
Yes.
Oh, okay, okay. So I can go ahead and take care of that immediately so I can start doing my AHIP after each
But you
module.
already did United Healthcare.
Right, I was talking about the AHIP portion, where I can get the
You
$50
can't go
discount.
back. You've already done 2026 certification for United Healthcare. You can't go back through United. Well, you can, but then you're doing the whole thing all over again
I got you.
through
Okay,
United. United, you're done with. You're finished.
okay,
You have to go through another carrier.
okay.
So, Ms. Faye, I'm sorry, go ahead.
But which would be the best carrier to go through out of Humana or UHC?
It doesn't matter. You got to do them all.
Okay.
Whichever one comes out first.
Okay. Which ones are open? Is UHC
I sent out a
open?
list to the people who are my business associates. You have a list in an
Okay.
email that tells you, and we did it in one of our meetings. So the
Okay.
list is in the summary as well. I don't remember them off the top of my head. I'm sorry.
Thank you.
So, Ms. Faye, do we have to do the AHIP? We have to do the AHIP first before we can do the certifications with any of the carriers. Is that correct?
That's
Or no?
correct, except United and Aetna.
Okay, United and Aetna. Okay.
But now
Okay.
those certifications for those two, because you're not doing AHIP, you, if you do the Aetna and you don't do AHIP, you can't do any of the other carriers. You can only sell Aetna. And it's going to be a longer process for the certification because you didn't do AHIP.
Okay.
What are your most fears about? Does anybody have fears? What are your most fears about AHIP? Anybody got any fears?
Not as long as you're teaching it like you're doing, I don't have no fears.
Okay, so now you know what you got to do. Once you get into AHIP, you're not in there now because you're going to wait to go through a carrier so you get $50 off. You took notes tonight. You don't have to go through each one of those slides that I went through. You're just going to go to the practice test and do the practice test as many times as you need to until you get all the answers correct. Understood? Okay, great.
Ms. Faye, one more question. When can we start the practice test on the module that you just taught us tonight?
When you are able to go into AHIP,
Okay,
pay for it,
that pay
and they
for it and
give you
stuff. Okay,
access. And
gotcha.
you won't be able to do that until you are able to go through a carrier, which tomorrow, if you got devoted, you could go through devoted, get your $50 off, go to AHIP, sign up, you'll be there at module 1.
Okay, gotcha. All right.
Got it? Okay. All right, thank you. I will see you all tomorrow at 8 p.m. Eastern.
Thank you so much.
You're
you.
welcome.
All right, good night.
Good
Good
night,
night.
everybody.